let's talk about some basic rights. You deserve to be treated with dignity. One of my first things is asking people what name they go by, because it might have absolutely nothing to do with the name that's on the paper. Ginger, Rocky, Junior, or just some other Mike. So that's the least somebody can, that is the least somebody can do, in my opinion. Okay? You deserve to have people who are respectful of you, of your time, of your home. And for all that, even if they are, it might not be a good fit. It just might not be a good fit for endless reasons. And they might not like you either. You don't know. We wouldn't fire you, but you could fire your therapist if you think you're not getting the best care. If you're not comfortable around them for whatever reason, if it's delicate, but I've been fired by a patient and I say thank you, because clearly that wasn't right. And sometimes it is so mutual. Sometimes I'm like, oh, thank goodness someone else can go, because I don't belong there. So you never know. You can speak up for yourself. It's a shame that we have to fight so hard for ourselves in our healthcare system these days, but we do have to advocate for ourselves. And it is strange that we are having a medical appointment, so it is business, but we are in your home. You're kind of hosting us in a way at the same time, and there should be a rapport that we're building. There should be trust. And if there's anything that's undermining any of that, that means that it's going to undermine your therapy. Some things, smaller things, you could try to clear up with your clinician or let another clinician know that there's an issue. But yes, you can fire. You can fire your clinician. And sometimes an agency will fire a patient if you cancel all the time. We can't keep holding space in the schedule. In our company, technically, 3 missed visits in a row amongst disciplines. Now, if you have a lot of doctor's appointments, that's a little bit different. But some people cancel just because, not today. Okay. Now, I feel that everybody gets a day. Being a patient is a full-time job. And if you were going to a job every day, sometimes you would take a day off. And sometimes, as a patient, you need a day off. I respect that 100%. But if you're a patient who never works, who never does homework, like exercises, who doesn't want to participate, who thinks you don't really need the things that we'd already agreed that you wanted to work on, that's a little bit different. I don't give those patients the same pass. But sometimes people are canceling a lot, but the reasons are so good. I mean, I don't hold it against anybody. If it's a patient who really needs help, I want to help. But it does go both ways. More importantly, they're there in their house, and you are in your house, and it's vulnerable. It is a vulnerable experience. And if you have any issues, it's okay to speak up. It's okay. We're used to it. Most of the time, we don't take it personally, and we just want you to get the help you need. It's okay. Just let somebody know.